Okay, Bruce, thank you very much. Another update coming up in just a few minutes. Right now for you, legendary guitarist Eddie Van Halen died Tuesday after a long battle with throat cancer.
And as Channel 3 Eyewitness News reporter Aya Galal explains, his death is raising some questions about the disease.
Tonight, fans are mourning the loss of one of the greatest guitarists in history. Eddie Van Halen, dead at 65 after a difficult battle with throat cancer. His death sending shockwaves through the music world and leaving fans everywhere heartbroken.
I was a teenager when they first broke on the scene, and I'm just really sad at the loss. I send my condolences to his family.
Van Halen's death also sparking questions surrounding throat cancer.
Every year, it lists among the top 10 most commonly detected cancers, more so in men.
Dr. Aarti Bhatia is an expert in head and neck cancer at the Yale Cancer Center.
Men are about 2 to 3 times at a higher risk for it than women are, likely because of their occupational exposures.
Van Halen struggled with drug and alcohol use. Dr. Bhatia says tobacco and alcohol use are the most common risk factors for developing throat cancer.
The longer your exposure to alcohol and tobacco use and the more intense your exposure, the greater the risk of acquiring head and neck cancers.
Before his battle with throat cancer, Van Halen had a bout with tongue cancer in 2000. He defeated the illness 2 years later, but doctors say patients remain at risk of having that cancer form again, even several years later. Those secondary primary cancers can be harder to treat.
So some common symptoms that patients report include maybe a mouth sore or a lump that won't heal.
Treatment for every patient is very individualized. Dr. Bhatia says there have been a lot of advances in treatments.
So there's a lot of optimism and hope on the horizon for newer treatments in the future as well.
This as the world remembers the life of one of the most talented guitarists of all time. Aya Galal, Channel 3 Eyewitness News.
Aya, thank you. Meanwhile, screening for throat cancer is recommended for people who have a significant history of smoking or drinking.
And the Yale Cancer Center runs several testing clinics each year across the state. If you'd like to learn more, head on over to the Channel 3 app. Much more news and weather is